Good morning, everyone. I'm Megan Culliff, along here with Scott Micklin.
Good morning. Good to see you. You're Steve Hebby this morning. How about that?
Oh,
You've been
man.
promoted.
It's true.
Yeah.
All right, get ready,
Let's
community.
fix that.
I'm coming after your safety. I don't.
Wow.
You can tell I'm not cut out for this.
That's
for the
disturbing.
chief of police job.
Right. Okay, we're fixing it. Stand by.
Could you imagine me on the beat?
Right.
I don't know.
I think. No,
What do you think?
I think you could. Yeah.
I could do it.
With some training.
Yeah, a lot of training. Yeah.
But there you go.
Yeah.
I know I feel safer when you're sitting in this room, not when you're wandering the city
thank you.
unsupervised. So, you know.
So, yeah, you feel safer when I'm in this room so you could supervise
I can
me.
keep an eye on you.
Yeah.
Yeah. That's fun. Yeah. You're welcome, community.
Yeah,
There you go.
exactly.
That's right.
Exactly.
So anyway.
Oh, cool, I'm me again.
You are, yes. It just takes a few seconds, which should have happened before we hit the air. But
I know. See, notice it never happens to Steve. Like, Steve is never Megan.
the chief,
Yeah,
yeah, no,
Chief Steve.
no,
Okay.
doesn't happen. But his show, in all fairness, is
It's on
Fridays
Friday.
at noon.
That's right.
And so there have been several hours
That's
getting
right.
ready for that show, whereas our show at 9 is immediately following my other show at 8. So I'm just going to say sorry.
Yeah, the best
If we
apologies
had a staff
don't have excuses
to yell
attached.
at. No, if I had a staff to yell at for that problem, I would do that. But it's my
don't.
fault. So it's
Yeah, there you
as
go.
we were saying, journalism 101. Here we go.
Yes, here we go again.
Again. Yeah. But anyway, it's Monday.
Yep.
And here we are.
Yep. And it's
the-
June 15th.
June 15th. Exactly.
Just get our grounding.
Yes. Week number, what are we now? 14?
We're in 14.
Week 14. Okay. The awkward teen years,
Right, that's
14.
right. We're in the awkward adolescence of coronavirus.
maybe, of the show.
It's kind of, well, and that's actually not far from the truth if you think about phasing.
Right.
Because adolescence is all about trying to figure out, like, who you are, where you're at, lots of growing pains. It feels apropos to me.
Yeah. Well, here we are.
Yeah.
And
I
anyone
think,
who's watched the show probably agrees with us.
yeah, they're like, you are getting progressively more awkward.
You're kind of
Yeah.
clumsy,
You
and
guys,
yeah,
Chief Steve over there.
that's right. That's right.
Yes. Well, yeah.
Yeah.
What were you going to say?
I was just going to say, so today on the show,
Yes.
we have a local pediatrician calling in here momentarily.
Good.
And so there were some questions that I know you had about some
Always.
stories that we've seen about the way this virus is now impacting children.
Mm-hmm.
And so we're going to get those questions answered, we hope. And I think he's prepared to
He's
answer
more
that
than
question.
qualified.
I would think so.
Yeah.
I would think so.
Way more qualified than us.
So we're looking forward to that, and then we're going to check some numbers and kind of do some housekeeping for today.
Housekeeping.
Yeah, to catch some numbers up and get everyone up to speed as we start the new week.
As we start the new week.
That's the plan. So I'm going to turn over here and get some stuff ready.
Cool.
So
Yeah, so I got the national numbers.
right,
As of Sunday night, 2,094,058 cases have been reported in the U.S. alone, which is an increase of 19,513 cases from yesterday. And 115,732 deaths have been attributed to the virus, which is an increase of 296 from yesterday. Again, this data comes from the Johns Hopkins University COVID-19 dashboard. And notably, of the 23,535,104 positive corona tests conducted in the United States, 8.9% have come back positive.
oh,
We don't usually hear
that number,
That number.
that percentage. We don't. That's true.
So.
Good to know.
Good to know.
Yeah, interesting. The other numbers that we're getting, we can share from our website again, ksje.com. These are coming from the State Health Department, of course. And again, with the Sunday numbers, they put out the disclaimer again that not every lab was reporting. So these
Gotcha,
numbers may be incomplete. But about 104 new cases across our state on Sunday. And so that leaves us to a total of 9,723, 15 more in San Juan County, but again, maybe incomplete, not sure. 4 additional deaths in our state for a total of 435, but none of those were from San Juan County, so we haven't seen any reports of 0 deaths on a daily report in
Ever.
quite a while, if ever.
Yeah.
That I'm thinking. So
Yeah.
if that holds true, that would be maybe obviously some good news.
Oh, yes.
So that would be good. But unfortunately, they're incomplete. So we don't know if the lab, if it's San Juan County numbers that aren't total
Okay.
or from other parts of the state.
Gotcha.
So that's the issue there. But the recovery is another 131 for a total of 4,114,
Gotcha.
which are recoveries from COVID. So I think that's
Yeah, finally we
important to
got
note.
more recoveries than cases. Quite a substantial amount more.
Well, that's statewide. We're
right.
still not
New recoveries. As
new
opposed to
recoveries
new
of cases. That's what you're
Right.
talking about. I
That's
got
what
you.
I'm talking
104
about.
new
Yes.
cases, 131 recoveries.
Right.
There you
Right.
are. I got. Now I follow.
Yes.
Got it. It's math, and it's Monday. So
I know.
enough said about that.
And it not yeah.
That's
okay.
right. The Navajo Nation, again, updated this morning. They're at 6,611. They had 57 new cases from Sunday and 3 additional deaths across the Navajo Nation. So those numbers are there as well. So they're continuing some of their activities to try to, again, flatten the curve and do all the things that we're supposed to be doing
That's right.
on the reservation. So there is that. I'm going to come back to you for just a moment because I wanted to also come up with the county, which had been updating their graphs with some of the averages, and they had kind of let that not update for the last couple of weeks, I guess, or no one had updated
They have
it.
let that not update.
Yeah.
They
and
had not updated it.
There's
I
that as
think.
well. That's another way to say it.
The
Sure.
passive voice is not as strong as the active voice, Scott.
I've heard that.
Yeah.
Yeah.
So
I would like to share those with everybody
yeah,
because normally we
yeah.
show those on Thursday, and now that they are updated
Right.
and are being updated, we can show those. So let me find them here.
Yeah. So it hit me this morning that it was March 11th that the country started waking up to this threat. You know what happened on March 11th?
What happened on March 11th?
The NBA canceled and Tom Hanks came down with it.
Oh,
And then everybody was like, uh-oh, it's
right.
real.
I think that's
Isn't that
true.
interesting?
That is
So I
interesting.
feel like as we reopen and stuff, it takes like some strong and loud cues to wake people up, as
Right.
opposed to a consistent stream of information. Human behavior.
Right.
I don't know.
I hear you. I like it.
I like it.
There you go.
Yeah.
I am not seeing any new updated graphs. That's why I'm pausing over here because I'm calling them up and I don't see that they're updated. But it may be the website is not behaving with our browser. It could be a technical issue, but they're still ending in May.
still okay.
And so I'd rather share them when we have them for people in June.
Yes.
To get some local numbers. But so anyway, but let's go to the phones. We can go to the phones.
It looks like the phone is ready.
We could do that. That's true. So let's go to the phones this morning. Good morning. You're on KSJE. Thanks for calling in this morning.
Hi, good morning.
Hello.
This is Brad Scoggins, Dr. Brad Scoggins here in San Juan Regional.
Yes, Dr. Scoggins, we were expecting your call, so thank you for calling in from San Juan Health Partners Pediatrics, and we appreciate you calling in because we have some questions, and of course wanted to hear from a pediatrician about COVID-19 and how we're dealing with it with children and anything new that we are learning. So maybe to get us started, can you kind of give us an idea of what you are seeing in your practice in San Juan County?
Yeah, happy to. Well, happy to be here on the air with you too, Scott, again. So we are thankfully not seeing a lot of kids with the coronavirus. The ones we are seeing are largely asymptomatic and are tested for other reasons, namely, preoperative screening is being done before anyone's taken to the operating room, and that includes kids. So I'd say that's probably the majority of the cases that we're seeing are kids with no symptoms that get tested for another reason and come up positive. At this point, I'm not aware of any hospitalized children here in San Juan County. I can't speak to the ER and what they're seeing if they've had to transfer any kids out. Overall, kids are faring fairly well with it. I think parents have been diligent with their quarantining.
Good. And I do have a question. We had heard a bit in the past couple of weeks about the multi-inflammatory syndrome in children. Can you speak a bit to that?
Yeah, of course. So it seems like nationwide there seem to be little pockets where this is happening. Quite unclear as to exactly what's going on. Sometimes it's suspected due to antibody testing. They'll see this inflammatory syndrome, and they'll run an antibody test and find that the kids got COVID-19. But we have not seen any here. I've heard of one case in Albuquerque that I think may be where this came to light here in New Mexico. But we have not had any kids here so far. This is a lot like a condition called Kawasaki disease. So the two are fairly difficult to distinguish between. And it's long been suspected that there may be a viral trigger for Kawasaki disease, but it's never been, to my knowledge, it's never been, a connection has never been clearly made. The other piece that I think should reassure people is that the kids that are getting the multi-system inflammatory response do seem to be recovering without significant comorbidities or complications. So that's a piece of good news.
That is good news. And so I have a question with all of these kids. We're in the summer months now, summer vacation months at least. And do you have any advice on how to keep our kids healthy and active, especially since a lot of the programming that parents might usually send their kids to has been canceled due to the disease? How do we keep our kids sane and healthy?
Yeah, I think the sane question is a really good one. Yeah. Being outdoors is definitely safe. I think this is calling to people's attention. This whole coronavirus outbreak is calling to people's attention. Hygiene habits that we probably should have at a baseline. Not necessarily the mask wearing, but definitely the good hand hygiene. Making sure that we are that we are limiting our exposures in a reasonable way. What I've always told people, though, is our immune systems need to be challenged, and if we're constantly keeping our kids inside, we're bleaching all of our surfaces all the time. We're completely ridding our environment of microbes. That's not really good either. So if you have a compelling reason to go through and decontaminate the house, like you've got a bad case of gastroenteritis, or you've had somebody come over that later tested for coronavirus, by all means go through and clean the whole house. Otherwise, though, it's actually good to keep our immune systems busy. There's been a series of studies and a whole hypothesis around the idea of keeping environments too clean in terms of developing things like asthma, allergies, and other autoimmune type diseases later in life. So definitely get outside, get some vitamin D from the sunlight, and you should wear sunscreen also. I'll add that caveat. And then don't be too obsessive with the cleaning unless there's reason to do so.
Good information. And Dr. Scoggins, I want to ask you a little bit about, as you mentioned, kind of keeping our immune systems working. And of course, some folks are concerned by being so socially distant that we're doing and physically distant that maybe our immune systems aren't getting the workout they normally would. And of course, we do want to protect them from this virus. But on the other hand, we still want to also get exposed to some other things to keep us robust and healthy. Isn't that part of this as well?
Yeah, it is, and I think that's part of the difficulty with this outbreak is knowing where that balance exists. With the uncertainty about people who may be spreading the virus without knowing that they are carrying it, which is not necessarily unique to coronavirus. We know if we stop random people on the sidewalk and ask them for a sample from their nose or their nasopharynx, likelihood is we're going to find a few viruses just hiding out in there, which probably explains the seasonal variations in a lot of the viral outbreaks that we see in general, including the coronaviruses that circulate on an annual basis. So that's part of the difficulty, and that's where being outside comes in handy. Several studies have actually shown that having a dog, believe it or not, puppy dog goes out and picks up a bunch of dirt and pollens and pet danders and so forth, and comes back in the house, and that keeps you pretty well exposed. If you have access to, like a farm or something like that, or any other sort of outdoor wildlife, just kind of being around those critters helps also. So yeah, there's ways to do it in a safe manner, I think, is the point. And then, if you don't mind, I'll dovetail onto that. As far as kids go, getting in and getting their routine childhood immunizations is another good way to make sure we don't have a second wave of pandemic, so to speak, of vaccine-preventable illnesses, because that is a big concern right now.
Great. So that's the dog thing will not keep the parents sane. I will say that.
That won't help. You don't think?
I don't know if that's going to help.
But
Okay,
Perhaps a well-mannered dog. Yeah.
there you go. An
Yes.
older one, not a puppy. Anyway, so the immunization point reminded me. So as we have a lot of conversation about vaccines going on, of course, and obviously that timeline is unspecified and all of that. But I just have a general question about vaccines. Are they different for children? I never thought to ask that. Is the flu shot different for kids, or does everybody get the same one?
Yeah, good question. So basically everybody gets the same flu shot. The only difference is in your first year of receiving the vaccine, and in most cases we're talking about fairly young children, you can get the flu vaccine as early as 6 months of age. And in that first season, we recommend 2 doses because it's been shown that to develop adequate immunity against the H1N1 strain from 2009, that you do need 2 doses. So that's sort of the only caveat there.
gotcha. Interesting. So now we know.
Now we know. See, it's all these burning questions, and now finally I have a doc to ask them.
That's right. There you go.
I mean, I suppose I could have always asked.
Not being
my
charged
doctor,
for a
but-
visit. So
Right,
we
exactly.
appreciate that, Dr.
Free
Scoggins.
advice.
Yeah, of course. No
Very
bills
much.
in the mail, I promise.
There you go. That's right. And so, Dr. Scoggins, as we kind of wrap up our conversation, though, is there anything that you are keeping an eye on or watching for as we learn more about this virus? Because there's so much that seems to be we don't know a lot about it, or we're learning more day to day, or things are changing, with masks and other other advice from the health professionals, I guess is what I would say, that kind of has evolved over time. Is there anything that you're keeping an eye on that you wish we had a little bit more clear picture of for this virus?
Yeah, of course. I think the 2 areas that I'm fairly interested in as far as getting our lives back to some normalcy, I think would be, what is the significance of the antibody testing that's becoming available? Does that actually indicate that you have conferred immunity if you have some evidence that you've been exposed to the virus? And I talked to a lot of people that claim they had a terrible viral illness back in January, and they really think it could have been coronavirus, but that was, of course, before we had tests. So, just anecdotally, lots of people tell me they think they've already had it. And if that is truly the case, then it would be interesting to see what the significance of the antibody test is, number one. Of course, the asymptomatic shedding, the studies that are done on it, thankfully kids are not seeming to get it at the rate that older adults do. So it would be interesting as far as getting the schools, talking about parent sanity, getting the schools back to some sense of normal operation in the fall. That would be a great question to have answered is, since kids don't seem to be getting it, does that mean that they're not spreading it as much? So that's a good question I'd like to see answered. So yeah, those are a couple of thoughts there.
Yeah, and so, I mean, we've already mentioned that kids seem to be less susceptible to this virus. Say a child contracted it, they were a serious case. We've heard about convalescent plasma being used for the more dire cases in adults. Is that a treatment that could be used for children as well?
I don't see why it wouldn't be. Yeah, like I said, thankfully I have not heard of any cases in kids where that's had to happen yet. I think there have been a few kids that have been sick with it in some of the bigger cities, and maybe a very small few that have been actually in ICUs. But I think in general they tend to bounce back pretty well, from what I understand. So I've not heard of any examples of that being used, but I don't see why it couldn't be.
Very good. Well, Dr. Scoggins, we appreciate you calling in this morning, and I know your colleagues at the hospital have reminded us that even in the midst of all this pandemics, there is still no reason not to have your regular visits with your doctor, and that goes for pediatricians as well, right? If kids are maybe going back to school in the fall, some of those health checks should still be done over the summer like normal, or if they're into sports and things like that. Would you advise folks keeping up with those appointments?
Oh, absolutely. Yeah, absolutely. And I'll kind of speak to that point a little bit. So as I mentioned, there's been some worry with we're seeing in multiple states fewer vaccines being ordered by pediatric practices. So that indicates to us that there's probably a lot of people that, maybe out of fear, are not coming in to get their routine vaccinations. And what we worry about is, not having immunity against polio or measles or, one of these other infectious diseases that are vaccine preventable. So we worry as people start to come back together, could those diseases start popping up again? So please, come in and get your vaccines. We're taking every precaution we can to make sure that people are safe when they come in here. So we have people actually check in from their cars, and then you're only brought in to the office to get your vitals done and go straight to a room. We have separate rooms for neonates. So we're taking several precautions to limit any exposure.
That's important to know, and very good. And those are those COVID-safe practices we hear about, I imagine. So there you go.
Yes, sir.
Very good. Well, Dr. Scoggins, we appreciate your time and the advice that you gave Megan. Thank you for that, and we will talk to you again soon.
A dog. Got it. Thank you.
Thanks. Have a good one.
Thank you very much, sir. Dr. Brad Scoggins from San Juan Health Partners Pediatrics, our guest here on KSJE. So there you go.
I love it.
Right?
You know how I love asking the dogs questions.
I know.
We might have to talk about once all of this passes, which who knows. Have you ever wanted to hear a specific definition to anytime soon in your life, right?
Right. Yeah, what does that mean?
For quite
That's
some
true.
time, they'll
That's
throw that
right.
out and you're like, I need to know what the sum in the sum time is, right?
Yeah, we don't know.
We don't know.
I don't think anybody knows.
Yeah,
That's
but
true.
anyway, I was going to
'Cause
plug.
somebody, I wish I remembered who said this, but someone said, we're not going to decide when the virus is gone. It's the virus that decides.
Well, I
that,
think
really.
a lot of docs are saying, Anthony Fauci said it just this past week, because we had these 4 states that began to reopen, some of whom went very quickly. They went from like 0 to 60.
Right.
And now we have some record high
We're looking
spikes.
at you, Florida, Arizona.
Actually, Florida's Arizona, though.
Arizona, yeah. Yeah, I know. So,
AZ.
yeah.
Our neighbors.
Right.
Neighbors.
Okay.
I think I was just thinking, I don't know what that was. Okay.
I don't know.
I don't know.
All right. I don't know. But anyway, I hear what you're saying.
Right.
That is a concern. And I wish we could say. And again, the other underlying thing is, too, the potentially second wave, even though folks are saying we're really not done with the first wave. And could there then in the fall, maybe when flu comes around again, we could get flu plus.
Right. Flu plus. Yeah,
COVID.
Exactly. That would be a nasty, nasty mix.
Yeah.
I would think.
Right. So
I would think.
folks are concerned about what that means and what that means for schools. You were talking about schools, and so
oh my gosh,
there are some colleges that are planning to maybe bring students back. No decision yet here at San Juan College, by the way, but maybe bring students back in a little earlier in August,
right?
And then at Thanksgiving, send them home, and they complete the semester from home,
right?
Because of the flu season and other things like that in the winter. So,
right. I mean, I guess we learn, there are many creative ways to deal with this, and there might be more ways to deal with it than to just wholesale do completely online. There are hybrid models. There are a lot of, I think I had heard that one of the districts had forced people to consider 3 different tracks, which is a lot of work up front, but is prudent, and I think it's safe to say that we all appreciate that.
That's
some
true.
extra prudence these days.
Exactly. So I think, and in fact, a lot of the local districts here have told me on the show that they are having several different plans, depending on what the state says they are allowed to do for the fall. And some may be face-to-face, some may be hybrid, some may be online, some could be half-day. You don't know.
We don't know.
They're ready for anything.
That's right.
So we'll see.
So a lot of it has to do with that whole surfaces question, too. Like, how long does it remain on surfaces and stuff like that?
Sure.
So.
But I think, too, as the good doctor said, if children aren't spreading it, that's great for children, but you still have to have an adult teacher in the classroom. You can't just have 25 kids running
right.
around.
Although if children are not spreading it, then the teachers should theoretically not get it. And then if children are less susceptible, then the teachers should not theoretically give it to the children, right?
Right. But there's more than one adult in a school.
True, so they can be giving it to each other.
Yeah.
Right.
So
they'd have to watch it. It's going to be really interesting. I mean, the pictures that are going to come out from this, I was thinking about this era, because now I'm like finding these weird pieces of littering, namely like the paper masks.
Uh-huh.
Have you found those sort of, you know.
I haven't seen a litter of masks,
Yeah,
but
unfortunately,
apparently you do.
humans, they litter. And so,
You get out more than I do.
I do. I get out a lot.
Yeah.
Yeah. So anyway, I'm seeing them around. I mean, I
Okay.
get out a lot outside, physically distanced. I don't
Sure.
do the
Right.
group, whatever, indoor things. But yeah.
Right.
So,
But
and
folks
just-
should throw their masks away properly.
they throw them away, and right, exactly. Especially since we don't want other people touching your mask.
No.
Defeat the purpose of
Right.
said mask. So, but yeah, I mean, I'm just thinking about like class photos and stuff this coming year. Like, is everybody gonna be wearing a mask in those? Can you imagine that? The next generation,
Right.
Not like Gen Z, but like their kids. looking
Not
at
that
those
class photos didn't look awkward enough already.
Yeah, exactly. Our
It's just
hair already looks bad
one
enough,
more
and then you
little-
put the mask on.
Yeah. I'm so sorry, kids.
I need to see your class photos, I think.
No, you don't. No one needs to see those. You really don't.
We need to see them.
The 70s were not a good time.
Same hair, I bet, for you.
Right. That never changes.
That never changes.
Thank you. That's right. Exactly. How did we start talking about me? We were talking about you.
You don't need to see my class photos either.
Right. Yeah.
Actually, they look, at least the high school ones look very, very similar to how I look right now.
Okay.
Like,
That's
I've been
good to know.
wearing these types of blouses and stuff forever, so.
That's the look.
Old soul. I don't know, it was not the look, but it was my look.
Yeah. Well, okay.
I was
That's-
never on the
you
cutting
go.
edge of fashion.
We could identify you if we had to.
Mm-hmm.
Gotcha. Okay. Very good. Well, we appreciate Dr. Scroggins calling in today
Yes.
to answer our questions.
Thanks, Doc.
And again, later on this week, we're going to get some information. We have guests lined up from the investment community.
That'll be fun.
Right.
I love me some stock market
What's
talk.
going on with the markets,
Yes.
right? Up, down, and sideways. I mean, it's
Down
just-
all around.
Yeah, so that'll be interesting. Some more businesses that are reopening and how they are making sure their customers
Are safe.
feel safe coming in and returning to their stores. So I think that's an important thing too. And we're going to get an update on the plasma, as we talked about, that
Yes,
convalescent
plasma, my favorite image of the year,
Right. So
besides the llama.
yeah, exactly. I know you love the llamas.
I do.
We didn't ask Dr. Scroggins about the llamas.
Scoggins? Yeah,
Yeah.
we didn't ask him
We
about
did-
the llamas.
We did not.
But, I mean, he'd probably be like, I have nothing to say about the llamas.
He may not
Can we
have been
direct
briefed.
us back to pediatrics, please?
He may not be briefed about the llamas, that's
exactly.
true. So-
Tell us about pediatric practice in llamas.
Exactly. Anyway, but
Cool.
phones are open if folks want to give us a call.
566-3909.
That's it. And if you have a suggestion for a guest you'd like to hear from on the show,
That'd be cool.
we'd love to hear from you, or just tell us again how you are dealing with week
14.
14? Yeah.
Yeah, how's everybody doing out there?
Yeah, around those awkward teen years of pandemic.
The adolescence of pandemic.
Right.
I'm on to something.
I feel kind of a little clumsy.
I'm going to
Yeah,
write up an article later today.
I think it's gangly. to
Nice.
coin a term. Yeah.
Yeah,
You like that?
I do.
Okay. There you go.
Wordsmith.
Thank you.
Yeah.
So there you are, everybody. But give us a call if you'd like to. But in the meantime, we are just going to kind of wrap up the show today.
Sure.
So,
Nobody needs to hear us ramble for any longer than
Well,
necessary.
right, which was about 5 minutes ago.
Yes, we were past due.
I imagine
Stick a
we
fork.
are. That's right. But we'll be back tomorrow.
Yes.
And with more guests, more information, local information, which is why we're here at 9 a.m. Live every morning, Monday through Thursday on Facebook and YouTube. And again, on the radio every afternoon at 5:06 p.m. on KSJE and KSJE.com. And of course, don't forget about KNMI every day at noon on their radio station, which is 88.9 Vertical Radio.
That's right.
We appreciate that. So, all right, everyone, have a great Monday. See you tomorrow. Bye-bye.